How are STD symptoms diagnosed by healthcare providers? Have you ever wondered how healthcare providers diagnose sexually transmitted diseases? The process is quite thorough and involves several steps to ensure accurate results. First, healthcare providers start by gathering detailed patient history. They ask about your symptoms, sexual history, and any recent activities that might pose a risk. This initial discussion helps them identify potential STDs and decide on the necessary tests. Next comes a physical examination. The provider will carefully check the genital, anal, and oral areas for any visible signs of infection. They look for sores, rashes, unusual discharge, swelling, or inflammation, which can indicate an STD. Once the examination is complete, the provider will collect samples for laboratory testing. This could involve swabs from various areas, such as the vagina, cervix, urethra, anus, or throat, depending on the symptoms. They may also ask for a urine sample, which is often a clean catch, to test for infections like chlamydia or gonorrhea. Blood samples might be taken to check for systemic infections like syphilis, HIV, or herpes. These samples are then analyzed for the presence of bacteria, viruses, or other pathogens. Laboratory tests can include microscopy, which looks for organisms or cells that suggest an infection. Culture tests help grow bacteria to identify the specific strain, guiding treatment options. Nucleic acid amplification tests are also common. These tests detect genetic material from pathogens and are particularly sensitive, making them effective for chlamydia and gonorrhea. In some cases, if symptoms are unclear or persistent, further diagnostic procedures may be recommended. These could include cystoscopy or endoscopy, although such procedures are less common for STDs. Healthcare providers also recommend routine screening for asymptomatic infections. Many STDs can exist without noticeable symptoms, so regular testing is vital, especially for high-risk groups like adolescents, men who have sex with men, and pregnant women. Additionally, some STDs can be detected with rapid tests or at-home testing kits. While these can provide quick results, any positive findings should be confirmed with a healthcare provider for proper treatment. After diagnosis, providers will discuss treatment options, prevention strategies, and the importance of notifying partners to reduce transmission. It is crucial to seek professional medical care for an accurate diagnosis and appropriate management rather than relying on self-diagnosis. This comprehensive approach aligns with current medical guidelines to ensure effective identification and treatment of STDs, minimizing complications and transmission.